So, two people, Emily Hernandez Major, that's not. Alyssa Rickles. Hi, Emily, if you can hear me, we're going to start this meeting soon, but it really needs to get started by our district manager. So I'm going to mute myself and we're going to hope that he waltzes in soon.
All right, thank you so much.
All right, does somebody unplug
Hi,
something?
Lily, I'll update
Somebody
you.
having some fun with me
We're
here?
going to start this meeting soon, but our district manager has to set up the room and he's working on it. I guess I'll. Hi. Hi. We're going to be starting a smidgen late because we have to set up the router in our conference room so that we can get the Zoom going.
Okay.
But Tamara's here and hang tight.
Okay, no rush. I'm here.
Holler if there's a problem. All right, everybody, it's the Stone Age here. We're having some connectivity issues as
It's
happens
not
with,
connectivity, actually. The power's off.
oh, the power's off. We're having some power issues, even more primitive. But welcome to the November meeting of Manhattan Community Board 2, our Human Services Committee. We're gonna do this a little bit until our power is running. We're gonna do this a little hodgepodgey. I'm gonna use my computer for the audio, and Emma, this wide shot here will be the video. So we'll start with introductions. I am Susanna Aaron. I'm the chair of the committee, and I'll just pass the computer.
Oh my
around.
God.
Hello, I'm Wayne Quadler, member of the committee.
I'm Ryder Kessler, also a member of the committee.
I am Emma Smith, also a member of the committee.
Hi, I'm Brendan McGrath. I'm just a resident who's visiting.
Tequila Ashley member. Burger member.
Hi, everyone. I'm Samara Felix. I'm the committee for coordinator for month.
Okay, your voice is very quiet. So Tamara Felix, seen here.
I'm the community affairs coordinator for Manhattan Outreach Consortium, also downtown Goddard, Alyssa.
Okay, so the Manhattan Outreach Consortium, for those who may have not heard of it, is a program run by the city, contracted with an organization called CUCS and subcontracted with other providers who cover different geographical areas, and their task is to do outreach to unsheltered people on the streets of New York City. We haven't met with representatives from the MOC for a long time, so it's really great to connect. There are a few other people I want to introduce. Alyssa, can you unmute yourself and introduce yourself?
Hi, everybody. My name is Alyssa Wrinkle. I'm the program director for the downtown mock team. So we cover the area 23rd Street and below, river to river.
So Alyssa is with the local group and Tamara is with the overseeing group. Is that fair to say? Yeah, okay. And Emily and Lily, it's such a small meeting that if you'd like to introduce yourselves, you may. And I'll let Emily, if you'd like to, let me see, I can, sorry, hold on a second. I'm gonna let you talk, just introduce yourself. And why can't I see this? Lily, here, Emily, why don't you allow to speak?
Can you hear me?
I can hear you. Yes. Do you want to
Okay.
introduce yourself?
Yeah, I'm currently a junior at NYU. I'm here on behalf of one of my classes, kind of to see how the dynamic of the community board works. So
Great.
this is for my urban infrastructure class. And so if you guys like want to go super in depth, that would be great for my notes. I'm just here taking notes on seeing how you guys work and how the structure of your meetings go.
Well, welcome. We're happy to have you.
Thank you very much.
I'm going to guess that Lily is in the same boat. Lily, are you able to speak? For some reason, it doesn't.
Can you hear me?
Yes, I can.
Hi. Yeah, so I'm a master's social work student, policy focus. I'm interning currently at Assemblymember Glick's office.
Okay.
Yeah. So just interested in what you guys have to say. I'm also taking notes.
Okay, great. So this is just going to be a freewheeling conversation. There are very few of us here. We're happy. We've met with the MOC with a mock before, but this has been a period post-COVID of where we have experienced the appearance of many unsheltered people on our streets. And last year we held a big meeting with other community boards on the subject of serious mental illness to try to understand the relationships between homelessness and serious mental illness and what kind of process there are. But we just want to see, I think the task of this meeting would be to understand what's going on the ground, what you're seeing in terms of trends and cases and particular situations. So I think anyone who would like to ask should, and we'll pass this computer around as we do. If you want, I'll kick it off, but I don't have to. Ryder, why don't you
Oh,
start?
no, I just was
You
gonna
go.
say maybe Alyssa could just give us an overview, kind of like
Yeah, good idea.
for people who are less familiar with
Great.
what they do.
Will you then, Alyssa, nice idea, give us an overview of what you do, just introduce us to the mock.
Definitely, yeah. So as you said, the Manhattan Outreach Consortium is, I'm sorry, was someone asking a question?
No, I was gonna ask, I'll ask tomorrow as well later.
So the consortium is the group that provides street homeless outreach for the whole island. So as you said, the main contract holder who receives the funding from Department of Homeless Services, going into depth a little bit here for our students, is a Center for Urban Community Services. And they, as you said, subcontract with 2 other agencies to cover the whole island. So there's different catchment areas for each of the teams. There's 4 teams total. And my agency also has a team that covers.
Just a second, sorry, I'm gonna lower I'm gonna,
You have to mute the output.
my output is out. My output is on. Oh, you, me.
Is it good now? Oh, now I can't hear you guys though.
We're gonna fix that. I would just have to not use my computer because it creates this horrible reverb.
While we wait, Alyssa, you said it was called the Center for Urban Community. I didn't get to hear the rest of that.
I have a feeling that they're hearing me in like a terrible echo when I talk. So should I wait to talk to her about that, guys? Okay.
Okay.
There she is.
Yes, so she can hear us.
There we go.
I can hear you.
You
I can hear you now.
Yahoo Mountain Dew, excellent.
Are we good?
All right. Let me, sorry, this has been a little disorienting and thanks for your patience. Actually, we'll start with Tamara because Tamara can talk about CUCS and the overall mock and then we'll talk about you as one of the organizations running your program. So where's the mic? Is this the mic? Round thing, okay. So Tamara,
Speak loud.
that would be great. And I don't know where the camera is. Let's see you. Is this? Okay, well, all right. So why don't you sit here? So that,
Get you another.
that's all right.
The camera's actually showing you.
Go ahead.
Okay, so why don't you tell us a little about the mock and your role in it, and then we'll go to listen and more about what's happened on the view.
Yeah, I get that a lot.
Go ahead.
Oh, that was next week's finish. So I'm Tamara, like I mentioned, can everybody hear me loud and clear? I'm sorry, to go over close, I'm a little bit stuffy. So like Alyssa mentioned, we are funded by Department of Homeless Services. There is 4 catchment area, starting with Downtown Garden, which is program director is Alyssa. She covers 23rd and below, river to river. Then we have Breaking Ground, which is,
A town?
yes, Breaking
Up
Ground.
to 49th, I think.
Yes, up to 49. Then we have Uptown Garter, which is from 60 up to 90 something.
Uh-huh.
And then we have CUCS, which is from 110 and above.
Okay. And I don't want to put you on the spot. So if there are questions that you don't feel comfortable answering, that's fine. I want
I'm sorry, the audio cut out for me.
Still blinking.
Oh, blinking. I don't know if you can hear us.
I can hear you now.
Okay, good. Thanks.
Okay, I'm gonna leave it alone for now.
So I was asking tomorrow, which of these catchment areas is busiest? Is there, do you have a sense of that or no?
I feel like each catchment area has its own busiest hotspots and own areas.
Okay. Should we toss it straight to the team on the ground?
Yes.
Okay, but you should feel free to chime in anytime. All right, so Alyssa, can you share with us, oh, and Nicole Barth is with us from,
Uh-oh, I can't hear you guys again. Nicole, can you hear them?
if I can just get on this.
Oh, there you are again.
All right, now we're back. Okay, let's hope that we don't have this. Our internet connection is unstable.
You guys are gone again. Yeah. This is Does anyone else in the Zoom hear them? Is it me?
No, it seems to be frozen. They
Okay.
seem frozen, yeah.
Okay, just making sure it's not on my end.
I feel like I run around my house and I do the same thing. And all of a sudden this red light starts to blink on my router and I'm like, why are you
Happened. We'll just run the challenge.
It was fine. And then suddenly you just went red. I don't know.
Okay, I heard that last sentence.
Meaning what sentence?
All right, I don't know if we're.
Quick, ask me a question.
Hello, what's your name? I guess you can hear us. All
Yeah.
right, I'll leave this here. I won't join it yet. Okay, so as we were saying, if you can share with us a little bit of background.
A little bit of what?
Background, did you hear
Oh.
that one?
Yes, okay. Just in terms of like our work in general, like what we do.
Let's start with your work in general and then we'll,
Okay.
as the kinks get worked out technologically, we'll be able to ease into an actual conversation.
Okay. To answer your earlier question, our catchment area is definitely the busiest. No, I'm biased. I'm being
You're joking.
hyperbolic, but I mean it's busiest is a good question because I think that there's like our area is definitely one of the largest caseloads, but it wasn't always that way. It wasn't always as big as it is now. I've seen the caseload go up over 100. We're at like 430 right now, I think. And when I first started as the director, like about a little over 2 years ago, we were at under 300. I'd have to look at the numbers, but we've gone up substantially in caseload sizes.
And you guys don't cover Penn Station or.
No.
So you're really 23rd and below, and you have that many people. Now.
Yeah.
What is a caseload? Can you describe for us what the
Yeah, sorry. So just basically what we do is we approach people. Everyone can hear me okay?
Yes.
Okay. So we approach people that are actually bedded down on the street, living on the street. We have teams that go out and actually engage people where they are. And we ask them if they're interested in housing services. Even if they're not interested in housing, there's a lot of other wraparound case management services that we can offer, which I'll talk about. But the main thing, the bread and butter of what we do is to get people into transitional and then eventually into permanent housing. So as everybody probably knows, New York City is one of the few cities that has a mandated right to shelter, which means that everybody that's sleeping on the street does legally have a right to a shelter bed, which is not the case in most cities. So that's a really cool thing about New York. However, as you also probably heard, a lot of people do not feel comfortable staying in shelters. So the outreach teams were designed to assist the people for whom the shelters weren't working for whatever reason. So a lot of the clients that we work with don't feel safe in the shelters, need more privacy, have different mental health diagnoses, so need more supports, things like this. And so the transitional housing options that we work with are a little bit different than the shelter system. They're still funded by DHS, but they're just a little bit different in terms of how they work and what they offer. So we work with safe havens and stabilization beds. They both do not have curfews. They're usually a little bit smaller, have more clinical staff. The safe havens have a higher level of support, so more staff on site, more likely to have like nurses, psychiatrists, social workers that work there in the building, things like this. But they still, serve meals. They're a place that somebody can stay all day. They don't have to leave, things like this.
So let me interrupt just for a second, because people here are familiar with Paul's Place, which is
that's
in the last year about on from West 14th Street, and it's a safe haven with 24 beds, 23 of which are occupied now. So that's an example of the model that you're describing. And those people, unlike regular shelters, which are referred through the intake system, the people who get safe haven beds are referred through the mock teams.
Correct. And so those are clients that are coming directly from the street through one of the mock teams, and they have a lot of services there on site. There's a couple of beds for clients who have very high medical needs. They have, medical nurses that work there on site and can help with medication monitoring and things like that. So there's some specialized services at that site as well. And that site also has a drop-in, which is somewhere that people can come 24 hours. It's not a bed, but it's somewhere where people can literally drop in, receive services, get out of the cold, have a meal, things like this.
Do laundry, enter a lottery for an overnight chair, not a bed, but a chair, lounge chair. And an obvious question to us who've been looking a lot at, shortage of housing and homelessness, are there enough safe haven beds for you to get people to?
Not even close. We have been getting, for the most part, we get a couple of beds a day available. A lot of times they're for dorm style in the Bronx, which a lot of our clients are not willing or able to go to for a variety of reasons. A lot of our clients are from our area, so they only really feel comfortable in our area. They have friends and family in the area. They have a lot of services in the area. They might have a hard time traveling. They might have mobility concerns. They might have a PTSD diagnosis that prevents them from using public transit. Also, a lot of our clients really don't feel safe or comfortable sharing a room, which I always say makes sense. I would never fall asleep in a room with someone I don't know. And so I think a lot of our clients, for obvious reasons, prefer a single room or at least a room with only a couple of other people. So the dorm style options really only work for a small number of people. And a lot of times that's all we have to offer our clients.
The other thing we've heard, though, about outreach is that it's a very frustrating and time-consuming effort. It takes a long time, lots of contacts to get people even to talk to you and to respond and to express an interest in receiving services. So I guess one of the questions is, in the people that you deal with, are you having to turn them away from safe haven beds because they don't want them? Or are you finding that or is it, are you just not getting enough people who want a bed?
Yeah. Any situation that you can imagine exists. So the situation that you describe exists, which is there's a lot of clients, there's a full spectrum. It's very difficult to speak to our population in general because there are so many different types of people that we work with who are at different stages of what they're willing to accept, what they're looking for, and our ability to meet the needs with the services that we have. So the situation that you described, which is where it takes like a lot of engagement effort over a long period of time, that definitely exists. And that is one thing that our teams, I think Tamara can speak to this as well, that our teams pride ourselves on across the board is we really try to meet the clients where they're at. We try to not be judgmental at all. We don't put pressure on people. We do encourage people. We want people to we care about people's well-being, of course, but we respect people as adults. We want them to make their own choices. Being homeless is not illegal here. So we do our best to keep people safe and to encourage them to accept the resources that are available. But we also really work on building a mutual relationship over time with people that aren't immediately willing to accept the services that are available. So that situation where it takes a long time and a lot of effort to build a rapport with someone, and eventually they trust us enough that they're willing to accept the services that are available, that 100% exists. The other situation where someone is like, yes, sign me up 100%. I want to come inside. I want to come inside today. I want my own apartment. I'll do whatever it takes. But I need my own room because I've been attacked in the shelter and I just don't feel comfortable falling asleep in a room with people I don't know. That happens much more often, where people are very willing to accept the services. We definitely have a lot of clients that it takes a long time to build the relationship and they don't agree right away to work with us. But I think it's way more common that people are willing to accept services and we just don't have the thing available that makes them feel safe and comfortable, or able to access the services that they already have and things like that. So, and then everything in between, people that are ambivalent, people that, say no today, say yes next week. There's a full spectrum of reactions.
Tamara, I want to encourage you to jump in wherever you feel comfortable. I guess a question I might have, and I'm not going to down this conversation, would be, how frequent is it a problem that you have what Alyssa is describing, that someone's like, yes, sign me up, and you have to say, I'm sorry, we don't have anything for you?
So my experience is different than Alyssa's because most of the referrals I get is normally through like hospitals or stuff like that. So I'm not actually hands-on, but the people we do encounter with those is most of the time they want either a single, because that's how they feel more comfortable, like Alyssa mentioned, or most of the time they just they about to be discharged and they just want something as soon as they get out. So they'd be open to like sharing a space with a dormitory or a double. But there are cases like Alyssa mentioned that where some people, they will prefer to stay there until a single become available because that's what they're comfortable with.
Wow, gosh, that's so tricky. Anyone like to, yes, yes.
To what extent is the already here winter weather and the coldness outside impacting your work, and what are you seeing clients' needs are, struggles are, concerns, safety concerns? Like, how does that impact getting unhoused people housed?
I think Alyssa want to answer first.
You want Alyssa to answer? Alyssa, to you.
Yeah, Tamara, just tell me to be quiet if you want to say something, because I can't always tell when you're about to talk. You guys are so small. Yeah, I mean, the winter months leads to a couple of different trends, I'd say. First of all, there's less beds available, right? So like in the warmer months, people will get beds and leave them for different reasons. People are more safe and more comfortable staying on the street when it's not so cold out for obvious reasons. So there's a scarcity of beds in the winter. And like I said recently, I mean, there's been a scarcity of beds for a while in general, but it definitely gets worse in the winter months. And also people are more willing to come inside. So the people that we are engaging, if in July, they might've been kind of ambivalent, I'm not sure if I really want to work, like now people are very much more willing to come inside, but there's not always the bed available. Another thing that happens is sometimes people will go into the shelter when they really didn't want to, because they really, it's a matter of like life or death when you're staying on the street when it's this cold. So if we aren't able to place them, some people do go into the shelter system when they weren't previously willing to engage with that system. Some people move into the subways during the winter. So a lot of times there's like crossover with the team that does outreach in the subways. They end up finding clients, and like vice versa when the weather gets warmer. In terms of need, it's really just beds. I think that a lot of, as we've talked about, a lot of people just really don't feel comfortable with the options that are available on a daily basis, and really do need a smaller space to be able to feel safe. So that's the biggest need, is to be able to, if we engage someone, our team really prides itself on trying to get people inside the same day whenever possible. We don't want people to have to wait, but the problem is a lot of times we just do not have any availability, period, or any availability for something that the client will feel comfortable accepting. And then, we work with a population that is in an extremely unstable point in their lives. So like, we might say, you know, check in with us tomorrow, but how is the person going to do that? You know, we have to find them again. Maybe they don't have a phone. Maybe, you know, they would have to call us from like a link phone or a friend's phone. And meanwhile, they're trying to like find somewhere to go to the bathroom and get something to eat. So it's very difficult to follow up with people on an ongoing basis to try to get them housed when we don't have something for them like the first time that we meet them.
Ryder?
Yeah, can you hear me?
Yeah.
Great. I have a lot of thoughts and questions, but I'm going to start with one about scarcity of stabilization beds and safe haven beds. I'm always interested in what we can do as a community board to advocate for things that'll improve the situation. And, you know, just to add a little bit of data, but that I'm sure you all know, but the folks here might not. From the Coalition for the Homeless report of the state of homelessness, the long-term stay rate of folks who actually stay in shelter when they come in. For congregate shelters, it's about 24%, but for safe havens, it's 63%. So not only will people go into a private, dignified shelter option more readily than they'll go into a congregate shelter, they'll also stay and get services and get access to longer-term housing. So obviously these work quite well, but out of 100,000 people in shelter, there's only a couple of thousand of these kinds of beds. So my sense is what we can do best is advocate for more safe haven and stabilization beds in our community district. We had the chance to have an additional safe haven in our community district that ultimately did not happen. But so I just want to ask if I'm right that that is what we can do. And also, I think a big piece of pushback we got when considering the 231 Grand Street Safe Haven was the idea that folks who would stay there are not actually local to this community, that we would be attracting folks from out of the community. So can you address that misconception about the kind of local need for people who are currently street homeless, who might access these beds if we advocated for them?
Yeah, you're 100% correct that would be a very important advocacy point. And I think that with that, advocating for less shared safe havens and stabilization beds, and I mean, even, you know, a lot of sites, like I said, you know, there's a middle ground between the dorm style and the singles, which is like some of these sites have like 2 to 5 people in a room. Even that can be very difficult for somebody. I mean, again, I can't say this enough, but imagine falling asleep in a room with someone that you do not know, especially someone that like doesn't have any resources. So it's very, 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 it's a hard sell. It's amazing to me that anyone accepts that option. I don't think I would. So I think the singles is really, in my opinion, the only dignified housing option. It's hard enough to share, you know, eating and bathroom facilities with people that you don't know, but being able to close your door and feel safe at night when you go to bed, I think is the only dignified option. And if we had more of those, we could definitely get more people inside faster. And in terms of your other question, 100%. The clients want to stay in a lot of, like I said, a lot of our clients are from the area. A lot of our clients have been in the area for a long time. People in New York mostly want to stay where they're used to. So many of the clients in the consortium in general are from New York. I used to work on the CUCS team, which is the Uptown team, many years ago. I had clients that had never in their life been below 110th Street and were not willing to go no matter what. So I think, you know, 100, I can't say exactly numbers. And, you know, of course they couldn't say, you know, locals only for the safe haven, but 100% yes. People like to stay where they're from, where they're used to. A huge portion of the referrals to Paul's Place, for example, are from my team. They're people that live in the community already, have been homeless in the community, sometimes from just like a couple of blocks away. I don't know exactly what the breakdown is. I don't know, Tamara, if you know, probably not off the top of your head, but we utilize a huge portion of the beds at Paul's Place. So the referrals to any safe haven in our area would definitely be substantially from this area.
Thank you.
I wanted to ask a couple things. One about what happens on a code blue night, probably tonight, where the temperatures dip below a certain degree, and you're legally required to give someone shelter and they're legally required to accept it, I think, right? Or they're not legally required.
No, so, no.
How does the
Sorry, was that your full question?
No, my first question is just, how does the code blue work?
Yeah. So the code blue is when we canvass for a specific list of who we've identified as vulnerable clients that are on the street that are currently refusing placement. So we have a specific group of people that we will check on. The list changes from time to time. So sometimes people end up getting a placement. Sometimes we can't find someone. Sometimes someone goes to the hospital. So it's always in flux. But we maintain a list of people that need to be checked on. And the teams during the evening, overnight, and early morning shift will check on those clients and make sure that they are okay. If they're not okay, they will be calling EMS for the person. And if the person, we always offer shelter at every engagement with the clients. So even if we don't have a safe haven or stabilization bed that they're interested in, we always, make sure that they're not at that point in time willing to accept a shelter referral. And we always make sure that they know that they have access to the shelter, that we can transport them to the shelter. So when we're engaging people during Code Blue, we're always offering that. We will also offer to bring them, they're allowed to warm up in hospitals. So we'll offer to bring them to a hospital or a warming center if they don't want to go into any sort of transitional housing. They're not required to take it though. The only time that we would forcibly remove someone is doing like a 958 removal, which is where we would be taking someone to the hospital for a psychiatric evaluation because we felt that they were a danger to themselves or others. That wouldn't necessarily be pertaining to Code Blue per se, but someone's inability to, for example, keep themselves safe from the elements during a Code Blue would potentially be a justification for a 958 removal.
Yeah, Keila.
How many children are you seeing or
Are you able to hear that?
individuals under 18, underage individuals?
Very rarely.
Okay.
Very rarely. Our team, we have to contact DHS if we see a child. Our team only works with single adults.
Okay.
I was interested in this, the mayor's policy of lowering the standard of involuntary removal to a hospital for evaluation. And I just there's been a lot of discussion about it, and there was a piece in the Times today about the mayor feels that it's been successful. I wanted to know just your impression of it from where you work.
Yeah, so the mayor didn't actually change anything that's written. He just made an announcement encouraging a more liberal interpretation of the law. But in terms of like the written law and policy, nothing changed.
Right.
In my clinical professional opinion, the 958 removal should be used only in extraordinary situations because if the client refuses the transport, they will be taken forcibly by police in handcuffs if needed. So it's something that is stripping the person of their right to choose where they are. I'm sorry, did somebody want to say something?
No, go ahead.
So yeah, this is a touchy subject. But it's
that's why I just wanted to know. I mean, I don't speak for the policy as a whole, but I'm just interested in your opinion. I recognize that you have a certain perspective also because of the nature of your work and the nature of your relationship. But I was interested it's very interesting to hear that. So
I've had I'll tell you this, I've had the designation for 5 years and I've done it twice. So I think it's a necessary tool. I think that, this is getting a little abstract, but I'll just say briefly, I think that paternalism in social work is always going to be a challenging ethical question. And I think that, obviously our clients' well-being is extremely important to us. That's why all of us do this work. However, they are adults, they are free, and we want to respect their right to make choices in their lives as well. That being said, I have seen both in the cases of removals that I've done and removals that other people have done, that these can be life-saving. And I do think that there does come a point when we do want to choose safety for someone if we think that they're unable to choose it for themselves. It's a very difficult clinical line to determine.
Yeah, so the interruption was me signaling that I wanted to ask a follow-up question. So you said that the written policy hasn't changed, but the mayor was encouraging its usage more. The reporting from the Times said that there were 137 removals, or so the mayor said, over the last 6 months. Is that up from the previous 6 months? And like, do you know quantitatively how much more it's being used, and quantitatively anything about the success, such as it might be judged, of the 137 removals he was boasting about?
Yeah, quantitatively, I'm not sure. My strong suspicion is that they have gone up significantly from before he made the announcement. I think it was about a year ago that he made the announcement.
It was November of last year.
November, yeah. So my guess is that it's up substantially. I think that one of the main reasons for that is that the DHS outreach teams that also have providers that are licensed to do 958s have been given the directive to do more of them. So that is, I think, everyone has their clinical judgment and their directives. So I'll just kind of leave that at that. And qualitatively, this is not based on anything scientific, but my impression is that it's the thing about 958 removals is that your power as a clinician ends when the person gets to the hospital. So that includes even making the person stay in the emergency room. So there is a lapse in terms of what the law actually says and what would be effective, because the law is saying a clinician has the right to say this person cannot choose for themselves in this moment. We need to keep them safe. They're not allowed to decide to stay where they are. Once they get into the hospital, if they're not immediately brought to a locked unit, if they have to be triaged through the emergency room for whatever reason, the emergency room is not locked. And a lot, the responsibility of NYPD and the EMS workers legally ends once you get to the hospital. So technically speaking, the 958 law gets you a ride to the hospital. What happens at that point is up to the policies of the hospital. So if the hospital puts you on a 1-to-1, that's not the same thing as NYPD having you in handcuffs, right? A 1-to-1 is not going to necessarily keep you in place. And the ER is not locked, the triage is not locked. So one of the issues that I've run into when I've done removals is kind of trying to advocate that the person not be permitted to leave the emergency room. And a lot of times when removals are happening, in my experience, for one of the ones that I did, the person never made it to a psychiatric unit because they had such severe medical issues, and no medical units are locked. So in terms of how effective this is at long-term care, that question kind of starts with what will happen once the removal is complete. And like I said, the removal is in and of itself is over the minute the person crosses the threshold into the Bellevue triage. I don't know if anyone's ever been there, but it's a chaotic place.
And you raise it, this recent conversation raises the question of mental illness. Even the question of independence and choice. I mean, you must deal with a lot of people who, at least, I mean, you're not a psychiatrist and you're not evaluating them, giving them a psychiatric evaluation on the street, but you must have a sense of whether they're suffering from serious mental illness or not. And I just wonder how that plays into the kinds of engagements that you have. I mean, we have, we walk the streets, the people that you see the most are the people who are walking and they're ranting and they're hearing voices and they're screaming, and we wonder about those people, having the decision to stay out on the street does not seem like a healthy decision for them. But I'm wondering if you draw the line at a different level than that.
Yeah, so I guess there was a couple of questions there. So we're not a mental health provider by nature, we're a housing provider. So like I said, that we provide a lot of wraparound services, and we try to help people with as many things as we can possibly help them with. And that would include, in certain cases, providing psychiatric services. We do have psychiatrists that work with our team. Primarily what they do is evaluations for housing packets. So we have basically 2.5 days a week. We have a psychiatrist. There's, like I said, we have 430 people on caseload approximately. And there's a handful of people that our psychiatrists will see like ongoing. So when someone's really not able to receive care in the community and they would benefit from our team, we will see someone for like ongoing psychiatric care. But the vast majority of what our mental health providers that we work with on our team do is trying to get these housing packets. So it's a one-time evaluation. It is specifically geared toward the questions that come up on the application for a housing packet. And that's sort of like the end of the engagement. We can absolutely refer to community providers, and we do that. But providing mental health services is not the bulk of the work that we do. We absolutely engage with people with mental health symptoms and diagnoses all the time. You mentioned people, talking to themselves, talking loudly to themselves. That in and of itself, although it can be sort of disarming, I think, to the community, is not a justification for removal.
I understand. I mean, the image I was bringing up was sort of casually brought up, but as someone who, we have seen people on the street who really strongly appear to have mental illness. They may be filthy. They lived on the street for a long time. They're not just talking to themselves. They're screaming. There might be, we've all heard also about crimes that have happened, sadly, from people who have been suffering serious mental illness. And so I understand and appreciate that your job is really housing. You're not mental health providers. How do you handle those situations?
So it really depends. It depends on the situation and the person. Anytime we engage with anyone, we're assessing for, do they need EMS? Do they need to be referred to the psychiatrist? Do they need to be referred to a community mental health provider? Do we need to get someone like myself to meet them to assess for a 958 removal? And that's an ongoing assessment anytime we meet with someone. So I think a lot of times what happens is that the clients might present really differently with us than they do in the community in general. Like sometimes someone can seem really frightening to the community, like screaming at the top of their lungs, and then they'll have a regular conversation with us. So I think, it's very difficult to give a general broad, like, what do we do with someone that might be experiencing internal stimuli for something like that? We're always assessing for any kind of emergency service, but like I said, in terms of removals, it is something that I use sparingly, and it really has to cross a threshold of a justification for, stripping the person of their right to choose what they're going to do.
Keela and then Ryder.
I'd love to know, you mentioned wraparound services a few times. So I'd love to know what those services were when I worked at what's now Mount Sinai, but it was called St. Luke's Roosevelt Hospital. We would offer families a program called CSPOA, and also specifically, like, can you assign caseworkers to people who can follow them and make sure they're keep an ongoing contact and make sure they get connected to services.
Yeah, I'm sorry. I think that we started talking about something else and I didn't finish my full spiel of what we do. But once we engage someone, we will add them, and we don't add someone the same day that we meet them. Otherwise our caseload would be 3,000 versus the 430 that it is. But we will, if we place someone, if we've seen them more than once, if we think that it's likely that we'll find them again, we will add them to our caseload, and we will work with them throughout the housing process. So as long as they don't disappear, We will help them with getting into transitional housing if they're willing to do that, and then eventually permanent housing, again, if they're willing to do that. And they'll be assigned a worker on our team that will follow them through that process. So, and the worker will work with them to meet whatever other needs that they have. So, for example, we will help people with activating their benefits or keeping their benefits active. We will help people with getting to medical appointments if they need that. We will help with scheduling medical and psychiatric appointments. So there's a lot of things that are needed for their housing packets, which are also like coincidentally a lot of things that are just needed for life. So they have to have an ID, they have to have their social security card, their birth certificate. I mentioned the psychiatric evaluation. We also do a psychosocial evaluation. We'll refer them to substance use treatment, inpatient or outpatient, things like that. So anything that comes up casework wise, we'll either do or we'll refer out. If they're interested in employment services, we can refer them for that as well. So yeah, that's kind of what the wraparound services entail. It just depends on the person. Again, our clients are very diverse. So some people are very independent and they just really need help with the housing packet. And they're like, I got everything else. And then some people that need to be brought to every single medical appointment and they have, need help with everything. So it's a full spectrum. I will say that right now, it's very difficult to staff these positions. The staff on my team have 50 clients right now. I normally carry a caseload of like 5 clients just so I don't get rusty. I have 25. So the caseloads are very, very high right now. Ideally, the caseload size for one of my staff would be 25 clients, which is the caseload that I'm carrying right now. And my staff have like double that. So we do the best we can, but like I said, the bread and butter of what we do is the housing services. When the clients get into the transitional housing, they'll have a worker, the case manager there as well. So once that happens, that person will take on the majority of the case management wraparound services work, and we will support, but our focus is always on getting people off of the street and into housing.
Yeah, Emma. I'm interested, like when you support that kind of transition, and also when you're, referring folks to safe havens, how do you exchange information and coordinate with these partners? I'm sure you know folks individually, but I guess how do you kind of keep a cohesive thread to the extent that I'm sure that's really challenging, but I'm curious if you use a system or a process, et cetera.
Yeah, we have the group that Tamara is a part of, so like the centralized mock management group, will actually send the referrals out, and then that will be an email thread that exists between us, the outreach team, and the safe haven providers, with all of the different people involved on the same email thread. The vast majority of our communication coordinating with clients is on email. Of course, we do call and go in person as well, but each client will have like an email thread with all of the different providers where we coordinate care. And then we follow them through the process. So it's not like we bring them to the safe haven and then we don't see them again. We follow them through the entire process until they get their own apartment, however long that takes. They'll stay on, and as long as we can find them still, they'll stay on caseload. And then we will keep them open at least 3 months after they have their own apartment, just to make sure everything's going well, before we eventually close them out.
I just want to get back to one thing you said at the beginning of this meeting, which was that you have seen a big increase in your caseload. And that kind of gets, why do you think that is? Why?
That's a great question. I really don't know. I mean, I think, the only macro thing that I can attribute that to is like post-pandemic economy. I really don't know. I mean, I'm not sure.
I mean, from where we stand, walking in our streets, there are a lot more people doing drugs. It looks like there are a lot more people on the street. It looks like there are a lot more people mental illness, but we just see that anecdotally. We have no idea if that's just, because we notice them more or not. But I wanted you.
Can we ask your question tomorrow too? Like, why?
Yeah, sure.
Why would
you have any sense?
Do you have an idea of why caseloads have increased, or?
I think it depends on, Alyssa could correct me if I'm wrong, but I feel like it probably increased more in the wintertime. Due to the weather. I just started a year ago, so I don't know how things was last year or stuff, so I really don't have much experience on how much it increased. But most of the time, like I mentioned, like my referrals come from hospitals or any third party stuff like that. And then from there, I'll either connect it to the teams or who was assigned to the region.
When you say hospitals, so the hospitals are letting go people to the streets and then telling you this person needs a house?
Oh, no, while they still in the hospital, let's say they
Okay.
charge in 2 weeks, that before that 2 weeks, let's say they didn't charge on December 14th.
Okay.
Prior, they would email, say, hey, we have this client here,
Okay, and then
and then stabilization bed or housing, if they're known to the teams, if they're not, can we place them, and then we start the process.
So that's coordinating them without actually meeting them on the street, but meeting them through a
Correct.
hospital.
But also, if they're being released from a hospital, do they get counted somewhere?
What do you mean counted somewhere?
I mean, like, let's say a hospital contacts you and says, I have a person who's potentially homeless, but it's time for them to get out.
Not every time, they pretty much let us know about 2 to 3 weeks ahead of time, and our main goal is before they are charged, we do find them somewhere. Most of the time, people that are in the hospital, they are open to like sharing. So most of the time, like Alyssa mentioned, we do have a lot of dormitory style. So most of the time, we will just place them if they're open for it into a dormitory style. And then from there, if they're willing to get transferred, then we can work on getting it that places.
When you say dormitory style, I think a lot of people imagine a room of 500 beds, but I've been told that that's really been winnowed out. What, do you have a feel for that? I mean, does it mean 12 beds? Does it mean 200 beds?
The amount of people vary depending on the safe havens. Some have up to 80, I believe. The VOA have like 80 villas.
But you're looking at safe havens. You're not going through this shelter system. I see. Okay, so never mind. Okay, so safe havens is a different model.
Still 80 beds in one room, right?
I don't know. I think it's normally like 10 to 12 or something like that. So it's not like a huge, VOA might be more. I'd have to check that. You might be right about that, Tamara, but.
What's VOA?
It's just one of the ones in the Bronx.
Oh, I see. Yeah.
There's just there's a lot of different providers, but the referrals from the hospitals is a pretty small, subset of the caseload, but they would be added to one of the team's caseloads based on where they were street homeless before they went to the hospital.
Ryder?
Yeah, so I had a 2-part question, but Susanna asked the first part about the increase in the caseload size. So like you all are stretched quite thin. Part of that is having more people in need. And I think your hypothesis that the pandemic disrupted people's connections to support systems and health providers and housing is apt. And also I think this is all downstream of housing prices and they're continuing to go up. So, but on the other side is your staff level. And I'm curious about the size of your contract and whether the budget cuts that the mayor has been talking about are going to impact your package, and also just general, like, I think even for the budget cuts, there's already a hiring freeze. Like, tell us about, the scale of your funding and what we can advocate for to increase it, and also how the budget cuts are playing in.
Yeah, so our funding is 100% from Department of Homeless Services. So we're fully funded by the city, and we are holding our breath to see which round of these budget cuts we are going to be included in. My understanding is, this is a little bit over my head, but my understanding is that we expect to be included at some point and have not yet. So we're just waiting to see what round we pop up in. So far, we've been spared. I guess it's possible, since homelessness has received so much media attention and so much attention from the mayor's office, that we will be spared. I think that it is unlikely.
And you guys had an increase in funding also, right? Like in the last few years, there was I remember when Erica Strang came to here at one point, and this must have been right after COVID, I guess. She said that the city had actually increased their funding, but that was a while ago.
I'm not sure about that. I don't remember, to be honest. I'm not sure if they've increased our funding anytime recently.
Well, you would know, you would see more people on your staff.
Are you able to tell us how big your staff is and the dollar amount of your contract?
So my team should be 21 people total, including managers and admin. We're at about 50% right now. And in terms of the dollar amount of how much money the downtown Goddard team in particular gets, I don't know. I'm not the main person that handles the budget. Tamara, do you know the size of the full mock contract?
And when you
It's
say.
not that I can't tell you, because I'm sure that it's public. I truly don't know.
We'll do that later.
Yeah, well.
But you
when
have like
say you're
11 staff.
When you're 50%, is that because you don't have money? Or is that because you just can't staff? People aren't.
We haven't had to cut any positions yet. And I hope that we won't. I hope that if we do get budget cuts, we'll be able to find the money other places, which would of course impact our services, but we really need all of the positions that we have. But yeah, it's very difficult to hire.
This is what we heard last spring when we were having a broader conversation about dealing with people with SMI. We heard over and over again that it's difficult to staff. There's just not enough social workers. There's not enough, the salary points are not high enough to compete with other employers, sort of thing.
Is it because they have a lot of time work?
Say that one more time.
Is it because they have to work at night?
Well, my team, I'm in charge of a team that covers the hours of 5:30 in the morning to 5 in the afternoon. So I don't have to staff the overnight team. That's a different team. But that definitely, those positions are very difficult to fill. A lot of times they're filled with people that have other jobs and are just trying to make some extra money on the nights and weekends. It's very, very difficult to staff those as well. What exactly their staffing numbers are, I'm not sure. But it's a very hard job, and to be frank, the pay is very low. It's people underestimate how challenging the job is. It's emotionally taxing. It's very busy. It's very stressful. The caseloads are always very high. The clients, we love them and we care about them deeply, but they can be extremely challenging. And it takes a lot. It takes a lot to do the job. And it's a very small group of people that are willing to do this challenging of a job for the amount of money that the role pays.
What is the salary?
I guess I can say this because it's under 40,000 starting. You can, if you go to the Goddard website, you can see the ranges. The name of the position is Housing Outreach Specialist. And I think that the low end of the starting is like 39.
Yeah.
So I have another question. I have a few more questions. Sprinkle in.
We want to hear from people who haven't.
Yeah. Just to editorialize for a moment, I think that is an obscenely low dollar amount, and it's not surprising that there's a 50% vacancy rate. And to the idea of 21 people for under 23rd Street for outreach to street homeless folks, I would ask us to think about how many police officers we have below 23rd Street. But my question is about other reporting I read recently. We think about what we can do as community board members, but we also think about what we can do as community members. And there was an article recently about how to handle as an individual, seeing someone who's street homeless and what to do. And it was an article about the author following what he understood to be the recommended protocol to call 311. And that he then was getting alerted that, someone was going 12 hours later and the person he had called about was no longer there, of course, or that he was calling 311, but it was, to avoid calling 911, but then cops would come anyway. So there was
one 311, he calls 311 and 15 minutes later he gets an email saying it's been resolved and, obviously nothing.
Yeah. So I guess what should we be doing and what should we be telling folks who ask us? And And are you, when we call 311, is that ultimately going to you? In which case I would fully understand why it takes a long time because there's 21 of you and there's a vacancy rate. But yeah, can you speak to that?
Yeah, so it's definitely the right avenue to encourage people to call 311, and that is the way to connect with an outreach team. I think, there's definitely, so there's a couple of reasons that it would take a while. Number one is multiple 311s at the same time, or the team that's in charge of responding to 311s is doing a transport. So something that will happen sometimes during our evening team is maybe there's only one team and we have assigned them to transport someone to a safe haven. Maybe they're in rush hour traffic and they're going up to the Bronx, and then they have to stay with that person for intake. And then after that, they would be getting to the 311. So that's just a hypothetical anecdotal example of a time, of a reason. The 311s are held during code blue. They go to NYPD. So they don't come to outreach during code blue because the team is occupied doing the vulnerability canvassing. If specific language is used in the 311 request that makes it seem like a legal issue or a danger, something that would trigger NYPD will respond instead of outreach. If the word encampment is used, NYPD will respond instead of outreach. I guess those are the main reasons that it would take a while.
That's helpful.
Is that,
Yeah.
should we advocate that changes? Like, should it not be the case that if encampment is used, that NYPD goes? Like, what?
Well, I think that the reason that exists, I mean, I always just tell people, because an encampment technically is like when someone basically like builds a house on the sidewalk, which is not legal. So it is legal to be homeless in New York. Like there's not like loitering laws preventing people from just existing on the sidewalk, right? Like, but they cannot build a structure and they cannot like take up the whole sidewalk. So like those are the rules. So if the 311 system is like very rigid about like, this is an outreach thing, this is an NYPD thing, and they don't ever have us both go. So if it's a legal issue where the person has like erected a structure, then that would be an NYPD thing because that person can be like, that whole situation can be dismantled like immediately without infringing on that person's legal rights. So that's very rare though. Like, I think that people will see someone like in a cardboard box to keep warm and be like encampment. So I usually tell people at community boards or whatever meetings I go to, don't use the word encampment unless there's actually an encampment, if you want the homeless outreach team to be able to go. And so I mean, I think that's fine as long as people understand the language that they're using. And yeah, and in terms of whether I think that I would just encourage people to be mindful about the language that they use, right? I think that sometimes people think that using hyperbolic language will create like a more intensified response. So they make the situation seem like super dangerous. But if that happens, then the 311 system is going to assume that it's a safety legal issue and send NYPD to address it. And then in that case, if the situation is like that dangerous, really the outreach team shouldn't even be going in the first place at that moment in time, right? We would want to wait until the situation is safe. And so I think that, again, all of this is, I think, fine in theory, as long as people use language that like accurately describes the situation that they're seeing.
What about interactions with other kinds of entities that the city and the state have created? IMT, Be Heard. There were a lot of terms that we heard when we were looking at SMI. Do you guys have interactions or coordination with any of these? Do you find them to be helpful or a hindrance or?
Yeah, the IMT teams are excellent. There's a super long wait list. So we do refer people for IMT teams sometimes and they'll get approved and it takes a really long time for them to get matched with a provider. IMT teams are excellent though. They're a really great resource for our clients that have high needs. They're a mobile team. They come into the field. They have psychiatric providers. They have really small caseloads and they do like very specialized work with clients that with, caseloads of 50 per person, we're not really able to do. Sometimes I think that their caseloads are like at 50 for the whole team.
Yeah, I think they're 20. Yeah, they're very small. Sorry.
Yeah. So they're able to do much more specialized work with people. So they're awesome. And we work very closely with IMT teams and I wish that many more of our clients had an IMT team. Be Heard, we haven't worked with much.
Yeah, I think Be Heard maybe isn't being dispatched down here.
Yeah,
do you know
that's
anything?
my understanding.
No, okay, never mind.
I don't think we have any down here yet. If we do, I haven't heard about it.
Also, it seems like my understanding of Be Heard is that it's meant to be a non-police response, but that in fact, the police are responding most of the time. So I don't know that even if we did have it, that how it's being implemented right now is really representative of what it's supposed to be.
Do you sense that police response is sort of monolithically crime oriented? Do you find that there are, I mean, we think of the police as just going in and putting handcuffs on people. Do they exact a positive outcome on occasions?
You're asking me if NYPD has the ability to enact positive outcomes? I'm sorry, was that the question?
Because
on the outreach population? I mean,
are they trained? Are they sensitive? Do they just come in like a bull in a china shop? I mean, what is your sense of that?
We don't work with NYPD too much. So like if NYPD is going to be at a situation, we generally try to not be there at the same time, because most of our clients don't want to be affiliated with an organization that like works with the police. So, you know, I feel similarly about involving NYPD as I do about doing removals. You know, it's something that obviously is necessary sometimes, and our client's safety is very important to us. And safety in general is very important. But it's not something that we do unless completely necessary. And we try to be very, very mindful about involving police with our population. I have definitely interacted with police officers that have had the ability to be person-centered and empathetic with our clients. I wouldn't say that it's the norm or that they have any specific training in how to interact with our clients, but I really couldn't speak to that. We really don't engage with NYPD too much.
I understand. Nicole from Councilmember Bach's office is on and has actually formally raised her hand.
Hi, everybody. Hi, Alyssa. So nice to see you. I have a question. I was wondering if you could clarify. You were just talking about encampments and the language that you use when you report. And you said that if you call in an encampment, the 311, it's going to go to the police, and the police can go there and they will take away the material that's creating the encampment. Sorry, I'll just make it, I just want to make sure I'm not doing things wrong when we reach out to you guys from our office, because I understood it to be that if people made a 311 about an encampment, for instance, we get ones where people build like elaborate like forts out of blankets and umbrellas and so forth, that the outreach would go there. It would trigger outreach, but it would also trigger the precinct to know that there's an encampment situation. And also, but I have never known our precinct to ever take anything away from the people that have created the encampment. It seems like the only way that can happen is after a certain length of time, they eventually get like a quote unquote eviction notice, and they have to leave that area. So I just want to be clear as to exactly what happens and how we should report a group of people or a person that has created a structure.
Yeah, so my understanding of like what legally an encampment means in terms of like how the 311 system functions is that it's a structure. So I think a lot of our clients, like you said, do different things to like protect themselves with like umbrellas, and like they kind of like create a little barrier for the elements, and maybe there's cardboard involved, plastic. I think to me, that's different from like a structure, which like technically, and this is my understanding, technically an encampment is like an actual structure that would be considered illegal, in the moment illegal. So what you're speaking of in terms of the process of like evicting someone is like when a report goes to the city and the city schedules a cleanup, and then sanitation goes, NYPD goes and like cleans everything up. My understanding is if someone has like created an actual structure, that is something that police can respond to immediately. Now, am I 100% right about that? Will they do that? I'm not sure exactly how that goes, but I think that a lot of times what's happening when someone says encampment is that it's not necessarily meeting the criteria for what like a physical structure that someone has built actually means. So like just those little things that people do to protect themselves is not really technically an encampment. But the one thing I can say for sure is that, and again, in terms of my understanding, the city can change things at any time, but as far as I know right now, the policy is if the word encampment is used, it goes to NYPD because that's a legal matter. And so if you want a homeless outreach team to respond, the language to use is a homeless person in need of assistance.
Okay. It's totally different. When I report an encampment, I usually ask people, it's usually a person or persons who have created something and lived there for a long time. Like we had someone was almost a month before they were removed from the area. As I understood it, if you 311 and you said there's an encampment and the police never take anything away from them until that final cleanup. They never take anything. So maybe we have to figure that out a little better because when I ask I am told when I do a 311 for an encampment, it triggers the police, it triggers outreach, and triggers sanitation. So maybe I have to follow through offline again with the 6th or with you to figure out exactly how we're reporting. I'm not talking about people that found a box and they're sleeping in it overnight or put up some umbrellas because it's raining that day. I'm talking about people that are like creating a home, in the somewhere and it's there for a long period of time. So
I think it comes down to what your intention is with the report. So if your intention is to have the items removed, because it's causing some sort of like blockage on the sidewalk or something like that, I would advise you to go to DHS and say this person, we would like to schedule a cleanup in this area. And that is when the thing that you're referring to where NYPD, sanitation, and outreach workers from DHS will come and will dispose of the items after a warning period, of course. That's not something that we're involved in because we're notified of that, but we really try to not be there unless there's a very specific reason to be there, because if we're affiliated with that process, it can be very damaging to the rapport. So if the goal is to have the items removed from the area, that would be sort of the avenue to have that happen, to have the cleanup happen. If you want the person to be outreached by the outreach team, to be engaged around housing services, just say homeless person in need of assistance. And that way it won't be rerouted to NYPD.
Excellent. Okay. Thank you very much for that. I appreciate it.
Yeah.
Note that Carter Booth added in the chat some resources to get better definitions of what an encampment is and how to deal with it. And I should also mention that Carter Booth and Donna Raftery, both who are not on this committee but are on our board, are at this meeting. And I don't know if you guys want to ask a question. We've heard a lot from some. Keen, do you have anything you'd like to ask?
No more, but
Brandon?
Appreciating Ryder's questions and your questions.
I guess my question is how can we advocate, or what can we advocate for? What do you need that we could, as a community board, try to provide or support you?
Yeah. So many things. I think that we've talked about a lot of them already. Advocacy around more safe haven and stabilization beds, more in our area, more singles. advocating. I mean, it feels crazy to advocate for more money right now, but I guess, you know, pipe dream, I would love to be able to properly fund these positions for what they really are, which is very professional and taxing labor. But at the very least, not get cut.
One thing that you mentioned, which is less of a money piece, but more of an organization piece, is this question of what happens with a, what did you call it, a 758 removal?
The 958. Yeah, that's
jurisdictions there, which is an interesting, that I totally didn't know anything about that.
Yeah, that would, I mean, I think that, you know, that would involve pretty high level like policy. I mean, I guess all of this stuff would. But yeah, some sort of policy change around what happens after the removal is complete on the hospital side. Whether that be maybe NYPD staying until the person is, you know, triaged and assessed and makes it into the psychiatric emergency room, which is locked, or is like on some kind of one-to-one, or, you know, some sort of assessment is made on the hospital side of whether or not the person has capacity to decide to leave.
Ian, did you want to say something?
Yeah, I just wanted, it occurred to me that the whole influx of migrants might impact the quality of your assistance, or how, what does that affect anything for you?
So there's the city has sort of created a separate system for the asylum seekers, and there's an intake shelter. So we've been instructed to transport people who are interested in seeking asylum to the asylum intake shelter. And that would basically function in the same way as if we had brought them to the DHS shelter system, which is that they're now in a separate system from outreach. So I can't say that that has impacted us significantly, because they've tried to keep the shelters and the pathway for that sort of separate.
Yeah, to Wayne's question about what we can advocate for, there's one more thing that I wonder what you think, which is the maintenance of right to shelter. So like the mayor, in addition to many things we've talked about, is also trying to end that. Would it, you know, I think the logic is if we didn't have right to shelter, we wouldn't be like attracting people to the city who are looking for better lives or what have you. But I think my sense, and curious what you think, if we didn't have the right to shelter, it would lead to a lot more street homelessness, not some, you know, silver bullet to prevent people who are in need from being in New York. So should we be passing a resolution to reinforce the vitality of right to shelter? Would that be beneficial?
Absolutely. Yeah, 100%. I think that the right to shelter is something to be really proud of. And it's unique. And 100%, I think that if the city didn't have mandated right to provide someone a safe place to sleep, that would significantly impact our services. Absolutely.
Good question, Ryder.
Yeah, thank you.
Does anyone else want to add anything?
Carter,
Put on the spot, or we're
No, Carter did a great
talking
job.
to you, and I'm started. Do I? Alyssa,
Carter has his hand raised.
Yeah, Carter, are you able to unmute yourself? Because
yep, I am. I just wanted to say, the right to shelter. I think I spoke at your guys' last meeting, is so important, and we really need to reinforce support for that, because it's really the lead point on the city's response, and to so many different things. The second thing is just anecdotally today, talking about community and what is community. I don't often go into 7-Eleven on Bowery, but I did today to get some coffee, and one of people who's been in our community for a long time often opens the door there, and is asking for help. And while I was in there pouring my coffee, one of the other gentlemen, who I believe works at the men's shelter on 3rd Street, came in and said hello to him, and they had a brief exchange, which I overheard, which included that he now had a home and had an apartment. And it was interesting, though, that the community is, you still come back to what you're used to. And, this older gentleman, he comes back there because that is his community. And that's an aspect that I think a lot of people forget when we have chronic homelessness and people are used to being in our community, that they still come back here because these are the people, you know, all of us who are around that they know. And that's some aspect of this puzzle that I think is important of creating stability, is, you know, coming to where you feel comfortable. And I think, you know, that's the Paul's Place and things like that are important. But once they're transitioned into housing, you know, they will still travel to come back. And I don't know if you have any more comments on that, Alyssa, or if that's, you know, that seems to be a big part of this picture of creating stability, is not just a home, but also being in an area that they're used to, and, you know, moving through that. But it was a small exchange that kind of brought to light a lot of the issues that we seem to be talking about tonight. And how do you ensure that people who are in their new housing have the supportive services to stay on track to keep their housing? I don't know if you have any thoughts on that, but it was an interesting thing to see in here in light of tonight's meeting.
Yeah, I think that, oh.
No, I'm sorry, go ahead.
I think that's a great question. And I think that that's something that could absolutely be added to the advocacy asks, is more permanent supportive housing in our area. So many of our clients are housed in other boroughs and, you know, are separated from their support system and what they feel comfortable with, as you mentioned. We actually have a client on caseload right now who's been in permanent housing for, I think, about a year. And we haven't closed out his case, even though our aftercare for permanent housing is usually only 3 months, because he is not using his apartment, because it's in the Bronx and he's still sleeping in the SDR area. So, you know, most likely what will happen is he will surrender the apartment or lose the apartment, and we'll have to kind of start all over again with him, which is really tragic because, you know, it's a lot of work on his part and a lot of time on his part and our part. And the reality is that it is very, very, very unlikely that he will find housing in this area. So 100%, I think that, you know, people deserve a right to stay in their community and the place that they feel safe and comfortable with their supports and their services. And I think it would be great if we were able to offer people that more often. And it is absolutely true that our clients will continue to come back to this area after they're housed. So yeah.
Apparently our battery's dying, but before, I wanted to ask some more questions. Anecdotally, success rates. What do you consider success? How many successes can you count? You know, do you count? I don't mean actual data, but is it a Sisyphean task?
Yeah, I mean, it feels like that sometimes because we're always adding more people to caseload. I mean, our caseloads, it only go up and up and up. So yeah, I mean, I think success is when someone gets off the street, and it's just as simple as that. I think that that can be such a huge accomplishment. And obviously, you know, our long-term goal is to get people into their own apartment, but short term, if we're able to get somebody a safe place to sleep and to take a shower and have something to eat, that's success. And we do make a lot of placements. I can get you, off the top of my head, I don't have our numbers, but I can get you our, you know, recent placement numbers if you all are interested in how many people. Okay.
Yes, I love that. Thank you. If you can email that to me, that'd be great. Actually.
Yeah, of course. I can send that over. I can send you for like the last fiscal year. Our fiscal year goes like June to June. So I can send you our.
You got it. We love data. Love data.
Yeah, but yeah, I mean, we definitely, we have very good stats, especially for how understaffed we are, for getting people inside, both in transitional and permanent housing. We always prioritize that, and of course, and
so you think that it's a stupid question? That's an obvious question. So you think that this is money well spent, and this is a fruitful, efficient, effective program?
The consortium in general?
Sure.
Yeah, of course. Absolutely. Absolutely. Yeah, it's necessary. It's definitely necessary.
Does anyone want to add, ask, anything else?
Could go on all night.
I know.
This feels a good place
Do you think so?
to leave it, yeah.
All right, we're gonna say goodnight to you then, and thank you so much for your time tonight. 8:01, not too bad.
Not too bad.
Thanks for coming in. Thank you for coming in.
Thank you.
And, and
I
thanks,
just wanted to say thanks for being interested in this topic and concerned about our clients and their well-being. It means a lot. And I think a lot of people I don't know, I think the community in general seems to respond so negatively just to even like seeing our clients. So to feel that people care enough to like learn how we do this and what the struggles are and how to advocate, that's meaningful, and I appreciate you all.
but one of the things that we always,
Tremendously.
things that we always struggle with also is creating bridges between these populations and the rest of our people. You know, you say if you talk to someone on the street, they're not nearly as scary as if you just see them. And it's hard to create those bridges.
Yeah,
And
definitely.
would always help in being able to do that.
Definitely.
Oh, wait, okay, someone has a follow-up question for her studies. I didn't see who
She
that was.
wants a point of contact.
Oh.
by the student.
Okay, Lily, I think, why don't you email me? I'm gonna give you my email now. It's Saron NYC, SAARONNYC Why I did that in a public recorded message, I don't know. All right. Thanks, guys.
Thank you.
Okay.
Are we-
Oh, yeah, should we have business? Yeah, I know you want. All right, we're gonna go into business session. You're allowed to listen in, but no one's gonna listen in, but you're just between us. How threatened is right to shelter at this point? I mean, I haven't heard about it in a long time.
Oh, it's very threatened right now, very threatened.
How so? Like, what does that mean? Does anyone have proposed a law to end it? I mean.
I think there is there's live litigation to challenge it, to challenge the consent decree that underlies it.
It's a tricky topic.
Litigation.
Such a tricky topic. I just wonder if there's any distinction made between the migrant seekers, which people view in general as a national problem, and our domestic homeless population, which is a local problem. You know what I mean?
Mhm.
You want a resolution about it?
I want a resolution.
You can do a resolution based on that, based on this conversation.
Well, I think, yeah, how capacious the resolution is open for discussion, of course. It
Yeah.
doesn't have to include right to shelter, although I think that would be relevant. But I think, starting from more safe haven and stabilization beds, period, in district, even better. Funding for this program so that salaries can be competitive, so that they don't have a 50% vacancy rate, I think would be worth including.
Right.
We might even want to have the resolution advocate for permanent housing in the district.
Yeah. I'm sorry to laugh.
Well,
I mean, not because I don't think it's important. I
Right.
just like from the movie Fat Chance. Yeah.
no, well, it starts with us asking for it.
Yes.
There's just not a lot of permanent housing in our.
And there's not a lot of
One of
appetite.
the highest
Yeah.
real estate values in the city.
Yeah.
The city itself struggles to put a homeless shelter. We have no homeless shelters other than the safe haven.
Oh, wow.
And that's on 14th Street, and there was one that was proposed on Canal Street, and there's one that was proposed way on Grand Street. I mean, the
And 11th
entrance-
Street, what happened to 11th?
11th Street has been challenged, but by a litigation, but that has been killed, so it should be going on, but I haven't heard anything about it. It's very difficult to place. But more importantly, I mean, we have expressed as a community board an interest in having affordable housing. The idea of having
In general.
of supportive housing in general, yes. A lot of our interest in affordable housing runs against a conflicting interest in preservation. And I think that what she was describing, which was supportive housing, it'd be hard to see that happen. I mean, just realistically, but I'm a bit of a cynic, so we should absolutely advocate for it and always.
I mean, can we build an argument based on right to shelter? Is that's a
my concern?
That's a policy for the whole city, right? for all of New York City.
Yeah.
So we could say, we support the existence of this policy.
Yeah, the
And-
only thing I feel about that is that just topic specifically was not our agenda. And it's a complicated topic. And we have not heard anyone make an argument why it should be challenged. And if we were going to entertain that topic, we would need to hear that voice. So I don't feel comfortable having a blanket statement about that. I think that certainly as a whereas, you know, I think it's valid to say, but I don't think that if we were really going to tease out that subject as a serious subject, it merits serious consideration from people who have, I'm sure, also valid reasons for wanting to challenge it.
Okay.
That's all.
Would we want to say anything about 958 removals?
Yeah, I mean, I don't know how you feel about, I mean, guys, you got it. Yeah, I want to invite you, by the way, you may leave.
Can I just like,
sorry,
to like just a.
You may
thought
leave.
thread?
I want to thank you for that.
Thank you for being here.
Night, cozy cocktail somewhere, I hope.
Thank you.
For coming.
In terms of just like, as the whereas, this is where I was thinking about it. Because in terms of thinking about making an argument for permanent housing, we can point to like many other cities around the world that say that, you know, and then using our own policy of right to shelter, we could say every community has a responsibility. We have this policy, right to shelter. We all have a responsibility to provide that. I mean, London is a city that has low income and supportive housing in every community, no matter if it's Notting Hill or the East End, or it doesn't matter. So we could build an argument like.
You mean housing is a right argument?
I mean, shelter is a right and a shelter is a house. And so you can, you know, a right to permanent housing is just an extension of that thing.
There's a couple of, I mean, you're dealing with the wrong person here on this, and I'm probably going to be an outlier in this group. I don't know that I think that housing is a right. I mean, I think it's always in the best interest of a city to do it, but I don't know that it's a right. So I wouldn't personally feel comfortable coming out with a statement that housing is a right. And also, again, it's a complicated issue. And I think if we wanted to have a conversation and come out with a resolution on that, I think it would merit its own time and its own discussion.
To that point, I do think maybe we should have a meeting that, you know, the board's gonna be hearing the city of Yes for Housing Opportunity, which is about like more housing, a little more housing in every neighborhood, including income restricted housing, et cetera. So I think it might be interesting for us to talk about that through our lens.
I agree. I think that there's a place for our committee to have a voice in that conversation.
For this, I do think it's fair if we say that one of the things very specifically connected to this outreach is the need at the end of the process for permanent supportive housing, that we need more, and maybe we could say like, and every community in the city should be contributing.
Absolutely.
Something like that.
I agree with that 100%. I mean, I think that the frustration of hearing this is you're doing all this great work and we hear how hard it is to get people engaged, and yet time and time again, it's not that the difficulty in getting them housing is not just that they don't want to talk to you, it's that you don't have anything to offer. And that's really tragic.
Right.
And also money that is then tossed aside. So you can't, you know, I mean, I'm exaggerating obviously because you can get them connected to other things, but it's what's the point if at the end you have nothing to give them?
Do children have a right to housing in the city?
Yes.
Yes.
Right to shelter.
Right to shelter. Right to shelter.
Or right to housing.
No. I don't.
Nobody has a right to.
I take that back.
I know I've been accurate based on my.
I have no idea.
The public hospital setting.
Yes, I
think there is right
idea
to housing for children.
Yes, and I know nothing about right.
It's just like the length of time they're entitled to be placed.
No, their children are not safe in many of the shelter areas. So there are specific shelters for families with children and mothers with children or parents with children or caregivers with children.
Well, shelters are definitely.
But then there are expedited processes of providing children and their caregivers with permanent housing. And I know that we have I mean, I worked with many families from this area who have permanent housing, income, but I think that if we do more digging, we'll find that there is, I feel like there is definitely a right to housing for children. But if it extends to children and caregivers of children who are also adults, you know, it leaves very fertile ground to say that, why should it stop there?
And that's a conversation of,
You know, and have that conversation. Yeah.
people are having. I just, you know, I don't think that for the purposes of what we write tonight, I think that would be a bit of a stretch, but I think that what we should do is work from everything that we've heard tonight, and we can certainly, you know, there are lots of conclusions that you draw from this, not even far-fetched conclusions, but you draw immediate conclusions. Like, it would be really good to have them be able to staff their staffs, which is what we said in the spring. Which is, it's the wrong climate for it. But it's really sad to me that no one has an insight about why there is more homelessness, or that there is. I don't even know that there is.
I think there is, and I think that data suggests it's because of housing prices. That even this street homelessness is ultimately
A ripple effect.
Yeah.
Housing prices. Yeah. Did you
because,
read that Houston piece? That piece about Houston?
yeah.
Yeah, thank you for sending that.
It's a really interesting piece. Is that all? I mean, that's a pipe dream. I mean, Houston has no zoning. Just a little
Someday
detail.
we could advocate and move it.
Oh, go well.
Well, we know what happens when we consider some changes in CB2.
Did they put in a new policy there, or what happened there?
Oh, no, there was some time for
Yeah.
Houston succeeding in finding housing for its homeless population.
Oh, okay.
And one of the factors that, of course, I latch onto is the fact that it's so much less expensive to build a unit of housing in Houston than it is here.
Which is attributable largely to the fact that there are not the same legal required hoops to jump through. It's legal to build housing in Houston in a way that it's not.
Yeah, we
here.
have a lot of oversight and community participation and hoops you have to jump. Not as bad as San Francisco, but we have it bad, and it all raises the cost of the unit of housing. Not to mention that we also have high land values. I mean, in this district particularly, but throughout the city, the land values are high. Okay, so we're gonna write some resolution and then see how it goes.
Do you want me to write it?
Yeah, if you would, I
I'd
don't
love to.
Hey, Susanna, I had my hand up. One of the things that struck me recently is a lot of the service providers have sold their properties in the lower Manhattan area to fund their endowments. And we've actually had a chosen exodus by groups from lower Manhattan. And now there's an interest in reentering at an even higher cost, as far as the facilities themselves. And that's
What are examples of those?
the Center for Urban Community Services sold the Showfields building, which was a women's shelter. It's now vacant because Showfields declared bankruptcy. We had Project Renewal further south on Lafayette sold, I think, their portion of a building as well to generate revenues. It's happened successively and slowly in the past along the Bowery as well. In the early 2000s, a number of buildings were sold. So
it's challenging.
And the
because I have
Children's
to
Day
say, I
Society.
was a not-for-profit provider, and I had a building that I could sell.
Well, isn't that what Beth Israel's gonna do?
Yeah, that I could sell my building, and with that money, I could fund the entire program. I wouldn't care where I was located. I would go somewhere else.
yeah, and St. Vincent's, another not in the housing business, but
Well, they
but
just went bankrupt.
but one of the things within all of this, though, is also making sure there's stability within the program providers so that they can stay. At the same time, the challenges in an environment where they're cutting the budgets, like you were just pointing out, we don't have many spaces for people to come into in our area. and that's a huge challenge, but around our periphery, we do to some extent, but then that brings a lot of other challenges. There's a lack of a city planning element in
Yeah.
this, but it's also just the challenge of the cost. And we had a couple of programs, without going into too much detail, that people had wanted, then the city never implemented. And it was in a little follow-up, it was just, why would we do that? It costs 4 times as much to do this program in your area where it provides a little benefit in other areas. And this is a huge challenge right now in our fiscal environment of getting services provided, but it's also stabilizing what we have. And that and it's, people have different feelings about different organizations, but for example, Salvation Army, right? That's on 14th Street. What's their state as a service provider? They own that building.
Yeah.
Are they staying? We have, so those are some of the other things I think in the coming year we might want to think about is making sure there's strength in those organizations. For Greenwich House, has had their struggles, at different points. So that's important to advocate for what we have now also in this. And I just, it annoys me to no end when I look at what was the Showfields building, that building was sold. It was a functioning women's shelter for many years, was sold, and now it's another vacant, overdeveloped building that is providing nothing. And so, that's a real challenge for us, for people who own buildings here, because if they have a funding crisis, selling that property may make more sense to them than operating out of them. And at the same time, we have people looking to lease spaces, and the only time they ever lease, the ones that we've looked at, are when the property owner is in distress, and that they're looking for a city contract for, some term that will cover the use of their space. And that, for example, the parking garage, right, for the homeless shelter down on Canal Street, or the hotel, these are all distressed properties they're looking for the city to become a tenant of. And, why does it always have to be that way? Why can't there be better planning where something can come from the ground up? Anyway, that's just a thought.
I'm just gonna, thanks, partner, that's great. I'm gonna also just call on Emily, who has her hand up. Emily, are you still there? No, okay, maybe that was the
Yes,
question.
sorry, yes, I'm still here.
Yes, did you have a question?
Yes, I didn't really have anything specific to the topics of tonight, but I did have a few questions for a few of the members there. I was wondering if you guys could respond, if I could send you guys an email and you guys respond to a few of my questions for my studies.
Yes, if you don't mind writing to the community board, community board 2, they'll get a message to me and I'll be happy to talk to you about anything.
Okay, great. Do you have their email by any chance so I could?
It is info, but I have no idea what it is.
info@manhattancb2.org.
Yeah.
I think that urban planning thing is really critical.
info@manhattancb2.org, and you can put in the subject, question for Susanna or whatever, human services.
And thank you.
All right, thank you guys. We're gonna say goodnight.
People are saying that, but I think the thing though, we don't have space. I think we have so much empty space in our community. It's not being used.
I know, but it's.
I should end meeting.
Urban plan.